Welcome to the Menopause Hour, your go-to source for empowering answers to your burning menopause questions, the ones you won't get from your OBGYN. Brought to you by Winona, menopause care made easy, and hosted by our experts, CMO Dr. Michael Green and Medical Director Dr. Kat Brown.
Hello, everyone, and welcome to another one of Winona's live Q&As with our amazing Winona doctors. We're so glad that you're here this evening or this afternoon if you're on the West Coast or if you're somewhere else. We're just here. We're just glad that you're here. We always say, it's such a big step kind of to, jump on one of these and ask your questions and really just, take your menopause journey by the reins and kind of jump in and want to learn a whole ton. So we're so glad you're here. If you've never been to one of these before, you can go ahead and start dropping your questions in the chat. It can get a little crazy, so we always recommend getting them in there quick. We'll try to get to as many as we possibly can. We do usually get through quite a few. So go ahead and start typing those in there, and we'll get to those in just a minute. But I'm going to go ahead and let our amazing doctors introduce themselves, and then we'll get to your questions. So, Dr. Green, let's go ahead and start with you tonight.
All right. Hi, my name's Mike Green. I am an OBGYN. I actually did a family practice residency first and kind of fell in love with women's health and realized that's where I wanted to spend my career. So here I am. I am the Chief Medical Officer of Winona, and it's just been an absolute thrill to be able to take care of so many women that don't otherwise have access to hormone replacement therapy for various reasons that Dr. Kat's going to talk about in a minute. But we're super happy to be here. We really, really believe in patient education. A well-informed patient is the best kind of patient. So you can advocate for your health and make really informed decisions about what you want to do, because it's not a one-size-fits-all thing. So the more you understand, the more you know, the better your care is going to be. So I'm really glad you're here so we can answer those questions and get you all the information you need. So take it away, Dr. Kat.
Sure. Hi, I'm Dr. Kat Brown, and I'm the medical director at Winona. I was actually the first doctor Dr. Green hired to help him out at Winona. And I'm a board certified OBGYN as well. I didn't do another residency before that, though. It was the only thing I wanted to do. So unlike Mike, it was one of my things. I just was very interested in women's health. And my interest in women's health has evolved over time. Obviously in our early careers, we spend a lot of time on obstetrics and delivering babies and doing birth control and helping women with crazy periods and helping women with infertility. But it wasn't until I started my own journey into perimenopause, which came a little earlier than I expected. And I was ill-equipped and ill-prepared as a board-certified OBGYN. I really thought I was going to be totally fine until I was 50. And surprise, 41, 42, things started. And I kept being in denial because I didn't have the knowledge and the power I needed to really get the help I needed. So when I came across Winona and the job came to me, it was a perfect opportunity because I had already kind of dove into learning as much as I could about everything because I wanted to help myself and advocate for myself. And so now I've turned that into advocating for patients. And Mike's right. I think that, the big goal that we have is really to help women across the country and really just try to get the word out. And one of the things that happened recently, which I think we need to talk about because we haven't had a webinar since this happened, but there was actually a really, really pivotal conversation that happened at the Food and Drug Administration recently. It was actually last Thursday, so a week ago today, that they had a panel discussion at the FDA, and they invited all these experts to talk and really to kind of plead their case about how the FDA should change some of the product labeling and some of the warnings that they've had on HRT. And the great thing is that one of the lead doctors at the FDA admitted that unfortunately, as a medical group of providers in the United States, we have really done patients a disservice since the Women's Health Initiative study, and all these black box warnings and scary verbiage has been mandated by the FDA to be on these medications when you receive them as a prescription. And unfortunately, it has deterred a lot of doctors, nurse practitioners, everybody alike, patients from getting the help they need. And they even had an orthopedic surgeon on this panel talking about how she wants to stop doing hip replacements and having to fix osteoporotic fractures. And if only we could give these women more estrogen, they could have prevented all that. And it was a really good discussion. And it's available for everyone to watch if you want to learn more. And basically each doctor had 5 minutes to talk. They had one slide that they could present. And so it was interesting. They got very creative in cramming as much information into one slide as they could. But there's a YouTube link and you can watch this panel discussion yourself. The replay is available for anybody. You don't have to be in the medical community to watch it. So that's something that I'm so excited about because these conversations are happening. Women are demanding better and women want better care. And so now it's gone to the FDA. And I think that the tide is changing. I think that hopefully things are going to improve moving forward so that women won't have so many roadblocks to getting the help they need to living the best life they can. So Maddie's going to drop the link in the chat. So those of you that are watching the webinar tonight can hopefully note that. And then we can even, I guess we can post it somewhere else and maybe in the Winona women's group if we want to do that, something like that. Yeah. But I think it's exciting thing to happen this month, in the field of menopause. Like it's a huge step forward, I think. So
the pendulum is definitely swinging in the right direction. And
Yeah.
I think we have a real advocate on the FDA to really fight for, making HRT more accessible, which is a great thing.
Yeah, absolutely. So
Yeah.
any questions?
I was going to say, yeah. And like Dr. Kat said, that link is in the chat. So please feel free to check that out. I think there's a lot of really great things to say in that panel. But we do have a good number of questions, so we can jump into them. Our first one tonight is from Christina. And Christina says, I hear not to use HRT due to cancer. Can you please explain the risks here?
Yeah. And this is probably one of the most common questions we get. And they actually touched on this in that panel too, because I think that so many patients have this unfounded fear that these medications are going to cause them to have cancer. And really, when you think about the overall risk and you look at probabilities, and if you ever took statistics in school, really your real chance of getting a cancer from taking one of these medications is pretty low. There's other factors, and obviously there's multiple things that can increase your risk of cancer, your genetics, your environment, and what you're exposed to. We probably expose ourselves to many more harmful things that do us harm than a medication would do. And so I think that some women out there, are reluctant to even try HRT because of the fear of breast cancer. But what they don't realize is that they are much more likely to die of a heart attack or heart disease than they ever will be of dying of breast cancer. So I think that, you have to put it into perspective. And that's something that you have to consider, weighing the risks and benefits of any medication, the risk of that is relatively low. Unless you have a genetic predisposition to a cancer, which we could get into more detail about, but there are some genes that some women can carry that can increase the risk for breast and ovarian cancer. And if you're one of those people, then obviously there's a different discussion you need to have with your doctor. But for the average population that doesn't have that, the risk is pretty low.
I like to look at it from a big picture point of view. Really, the goal is to live as long a healthy life as possible. The one thing everyone in the world can pretty much agree on is that everybody has to die at least once. So you won't find very many people that disagree with that. The idea is to put that off as long as you can, as long as you're living a happy, healthy life. If you look at women that are on HRT compared to women that do not take it, they're more likely to live longer and healthier lives. Eventually, somebody's going to get all of us. But again, as long as the thing that you're taking is going to help you live longer and healthier, that's the big picture. That's what's important. And HRT will help you do that. So you can kind of dive into little things and pair out little thing. Well, it can increase this. Yeah, but it decreases this, which is so much more important. So the cancer risk is very, very much overblown. And it's really kind of a shame, actually, because cancer risk is extremely small and the benefit is so great that it really also compares.
Absolutely. And our next question tonight is from Amy. Amy says, hello. She says, my question is, I just started the DHEA, the estriol, and the progesterone. She says, all in pill form. She says, is it safe to take ibuprofen or Tylenol alongside the medications?
Yes, it's perfectly fine to take those. Just make sure that you're following the labels on those bottles and not taking, larger amounts than they recommend. But yeah, they're safe to take with our meds.
Absolutely. And our next question comes from Kim. And I'm probably going to pronounce the name of this medication wrong. She says, I'm taking Auvelity, Auvelity for depression. And she said, I'm slightly concerned about how my HRT therapy will interact or heighten its effect. She says, I take a starting dose and then 0.50 estrace of 200 milligrams progesterone. Should I be concerned about this?
I'm not really familiar with that particular medication. Sounds like it's a newer medication for depression. I'd have to look it up to see what the generic name of it is.
I'm gonna try to read this. I'm gonna Google it real quick.
Dive in.
Yeah, it's not one that I have experience prescribing, which means it's probably relatively new. And if you're one of our patients, you can certainly ask your Winona doctor. But if you're not and you're getting your HRT from another source, don't ever be afraid to ask your doctors if it's okay. But generally, HRT is pretty safe to take along with most of the SSRIs and the NSRIs that are used for depression and anxiety pretty readily and pretty commonly. I'm just not familiar with that newer medication.
Yeah, so it looks like it's a combination of bupropion and dextromethorphan. So that should be fine with HRT.
Yeah.
Shouldn't be any problem at all. But again, message your doctor so they can look at, all your specifics. But I don't see any reason why that would be an issue.
And our next
Let me just say something real quick. Sorry. I'm going to get out of new rabbit trail. So doctors sometimes get annoyed because when patients Google something, they say, well, I did my research and this and that, which is great. Like we want people to look stuff up. But the difference is when we look things up like you just watch me do, I do that with this big fund of knowledge so that I can look at something very quickly and say, oh, it's this and this and this class. And I have experience with other things that are similar and able to, in that context, then quickly be able to determine things. It's a little bit different. So like, for instance, I don't know anything about auto mechanics. If I Google something about my car, I'm not really going to understand a lot of what is telling me. And so for me to tell if my mechanic looks it up, he's going, oh, well, yeah, because of this and that and this, it means that. So there is a little bit of a difference. So yes, we do Google things, but we do that because in the old days, we used to have these big reference books, right? And we look things up in these reference books. Now we have an even bigger reference book. It's called the internet. But it's really an adjunct to the big fund of knowledge that we have that helps put things in context. So since we just had a little object lesson.
Yeah, there we go.
I love that, Dr. Green. I think that's like a great rabbit trail to go down. I think gives us a little bit of context and everything. So that was great.
Yeah. One of my colleagues a few years ago used to have a mug that said, like, don't confuse your Google search with my medical degree. And I used to love that mug because we used to have patients Google things, print things out and bring them to the office all the time saying, well, I think I have this. And so then we would work through it. But it's so true. It's so true.
Well, it's like in medical school, each disease you learn, you swear you have it.
And it looks like our next question tonight is from Gina. Gina says, I'm 56 and I've been using Winona for approximately 4 years now. Is there a limit to how long I can be on HRT?
There's really not a hard stop. Years ago, we used to give women the guidance, to use the lowest dose for the shortest duration possible to get through the hardest part of menopause. But more and more information is coming out about all the benefits that estrogen and HRT has on your overall health and well-being. So unless you develop other medical problems or comorbidities, as we call them in the medical community, that would make these medications more dangerous to you, then there's really no reason you need to stop. And I am on HRT myself, and you're going to have to pry it out of my cold, dead hands, I think.
It's like the orthopedic surgeon on the FDA panel, it decreases the risk of osteoporosis. So there's this long-term benefit, and the longer you're on it, the more benefit you get. So maybe you won't need to get that hip replacement or, have, an emergency.
Have a fracture that you don't ever really recover from, which, it's crazy.
And it looks like our next question tonight is from Melissa. Melissa is wondering, What is the difference, if any, between sweet yam cream and bioidentical HRT? And can I do both?
Well, so when you're getting a cream that's called sweet yam cream, or if it's something you can purchase over the counter through the internet on your own without a prescription, that means it is not a prescription grade medication. It may have some hormone in it, but usually these are such a low dose that that means that the company can sell it without a prescription, without a doctor's prescription. Whereas the bioidentical HRT, this is actually prescription medication that we're prescribing to you. And at Winona, you have a board certified physician who is prescribing those medications for you, reviewing your medical history and making sure that they're safe. So if you're using something that's over the counter and it's helping you, but it's really not adequately treating everything, chances are if you start bioidentical HRT, you're probably not going to need that anymore. And you can save the expense of buying the over the counter thing because it's not going to be necessary.
Absolutely. And our next question is, what things can I do to supplement or complement the HRT to decrease anxiety and hot flashes?
So there's, behavioral things and lifestyle things that you can do. We have a lot of articles about this in the medical journal page of our website. So if you go to winona.com and you click on the learn, I think is what the title is. There's a lot of articles on there, but there's things that you can do avoiding certain foods and drinks that can sometimes exacerbate hot flashes. And unfortunately, ladies, this means alcohol usually. And all the good things in life, like chocolate and hard cheeses and all kinds of good stuff. Sometimes women will get cooling sheets, or a cooling pillow or a mattress cover that has a cooling effect to it. So if you're really suffering from night sweats, you can do those lifestyle things. There's even stores that sell fabric clothing that are actually meant to be like a wicking fabric to help with the hot flashes. And the key is, dressing in layers when it's the colder environment so that if you get warm, you can take a layer off. In the summertime, it's hard. You can get all kinds of different fans. There's fans you can plug into your phone. The key really that's really important, though, is hydration, optimizing your sleep as much as possible, drinking as much water as you can, and eating healthy. Eating foods that fuel your body and that have good nutrition and good vitamins and minerals that your body needs, making sure you get enough protein in your diet, making sure you get enough fiber in your diet, and moving your body. Women that exercise and actually have movement and physical activity in their lives do much better than women that are sedentary. And so this is something that, incorporating all these things into your life will help the overall time period while you're getting through this transition and help complement the medication, because the medication alone can't fix everything. You have to put some work in to do the hard work to help as well.
And our next question tonight is from Carrie. Carrie is wondering, she says, my question is, which would be causing acne, DHEA, estriol, or progesterone, and why might that be?
It's the DHEA, unfortunately. And for most women, this is a temporary side effect when they start a DHEA, supplement. But what the DHEA does is that it can change the way your skin is behaving. And actually, some women see some benefits in this, in that it can help, replenish the tissue, like on your scalp. It can make your scalp retain its oils better. But as a result, it can also help, with clogging of pores and things like that as well. And so for a lot of women that have the acne side effect of DHEA, if you can get over that initial hurdle of dealing with that and feeling like a teenager again, maybe get a good acne wash, making sure that you're doing everything else for your skin, looking at your makeups and whatever it is that you put on your face to make sure that they're non-comedogenic, they're not also contributing to acne. Usually it gets better after the first couple months if you do experience it. It's a temporary side effect.
Absolutely. And just to kind of touch on the skincare as well on my end, if you all haven't heard, we also have our new Winona app that has come out recently, and we have a lot of new courses on there, which are really exciting. We have a skincare course, we have a makeup course, we've got lots of other ones as well. So that's also, if you're kind of wanting to dive into your skincare journey a little bit, that's a great place to go as well. Just something that, I don't usually add on things, so I've got to do a little plug there.
Yeah. Well, that's great.
Well, our next question tonight is from Rosa. And Rosa says, do the hormones cause painful nipples? Does it help achieve orgasm? I lost my ability.
So as far as the painful nipples, it can cause breast tenderness. And for some women, that can equate to nipple sensitivity or nipple tenderness as well. And usually that's a temporary side effect as your body responds to starting a hormone. And that will get better with time if we've gotten the dosage right. If you continue to have discomfort or tenderness several months into a treatment, then we might need to adjust your dosage. So reach out to your doctor. As far as the achieving orgasm, I mean, it's so many different factors go into that. But our estrogen as women, that contributes to it. Our testosterone also contributes to it. But also there's a lot of other things that go into sex drive and libido and ability to achieve orgasm that can go much bigger than this conversation. It's one of our most important sex organs as a woman is our brain. And sometimes we can't turn it off. Sometimes it's like, did I leave the oven on? Did I do this? Did I do that? You're running through the grocery list. And a lot of women have a hard time like totally letting go. If it's a physical thing, you feel like you've done all the work into a relationship and you trust your partner, we also have a product that we can offer that can help you achieve orgasm better, and it's called Blossom. This is a topical medication that you can apply to the clitoris about 30 minutes before you're intending to be intimate. And what it does is it kind of acts like a female Viagra in that it sends blood rushing to those tissues, causing them to get a little bit engorged and to feel, more stimulation. So for women, it can help improve your ability to achieve orgasm and improve your satisfaction and your, experience of having sexual activity. So that's something that we can try.
Absolutely. And our next question is from Tamara. And she's wondering, she says, I'm about 10 weeks into my HRT. I'm using the DHEA pill and combo cream. She says, but I feel like I've been getting some negative effects, maybe more than some positive ones. And I'm trying to figure out if this is right for me and if I should stick with it. She says, the few positives I'm noticing are improving sleep quality. And then she says, but I also feel that my mood swings have increased. Have been difficult to manage. I haven't seen positive changes in my libido yet, and I haven't lost any weight. She says, do you have any thoughts on this and helping me decide what to do?
Yeah, the hard part is that sometimes some women will get more issues in the beginning that they have to kind of get over that hurdle. But the weight loss, I think that we have to be realistic and set expectations that weight loss is one of the later benefits that women really start to see after their hormones have been optimized and after they've been established on HRT and on that dosage for a while. Then you start to see the benefits of it. It takes time to kind of reverse that negative pattern in your body of the high cortisol levels and high stress states and get everything into balance. The mood swings, sometimes, that can be related to starting hormones and starting things differently. But what I would do is if you're 10 weeks in, you should be getting your follow-up questionnaire soon if you haven't gotten it already. And I would talk to your Winona doctor about this because maybe there's something that can be done to kind of tweak your regimen to get you feeling better. Because by the 10-week mark, we should start to see like an overall positive, I think, for most patients. But the weight loss is the one thing I would encourage you to just give it more time. That's something that we usually see like 3 to 6 months down the line. We start to see some benefits of that. You want to add to that, Mike?
Yeah, I mean, this is, if you're 10 weeks, you're about to come up on a refill, and this may be the time to tweak the dose a bit. So yeah, you will be getting a follow-up if you haven't already. And this is the time we like to send it because it's really a good time to kind of step back and look and see where you're at. And this is the right time to adjust a dose if that's what's needed. So it may be a small little adjustment of your dose might get you more benefit, or it may just be a more time issue. But I think probably a small adjustment might be helpful for you, and you can work with your doctor or your Winona doctor on that.
Absolutely. And our next question tonight is from Jane. And Jane wants to know what makes Winona stand out from other HRT medications.
Well, I think the biggest
both of us.
You're right there.
No, all joking aside, honestly, there aren't a lot of companies that do this. And we have a real commitment to not just throwing medicine at you, but education, outreach, making sure people understand, answering questions. I think we built, a culture of not just, let me prescribe medicine, but really to have a relationship with your doctor. We just interviewed someone today. And I was explaining how we do a continuity of care approach at Winona, where once you're doctor accepts you as a patient, you get the same doctor every time. I mean, unless we're on vacation or something. But so when you message in, you get the same doctor. You build a relationship with that doctor. Most of the other telehealth companies, and this doctor was surprised because she works for other companies. It's like, oh, the other companies I work for don't do it this way. But like whoever happens to be on just grabs you the message and sort of answers the message. And so this continuity of care approach, we really try to build this the way I would want my doctor, the way I have my doctor in real life, the way, in a sort of what we call brick and mortar practice. You really expect to see the same person develop a relationship. And I can tell you, I've been doing this with Winona now for 4 years, and I've got some patients I really developed significant doctor-patient relationships with. And I think it's extremely helpful. So we do a lot of things differently, I think, than a lot of the other companies. And I think, it really benefits patients that way. We're also the biggest provider of compounded HRT in the country. And we have our own compounding pharmacies, which means we are able to control the quality because compounding is a bit of an art, and it really can vary from one pharmacy to another. So the fact that we have our own compounding pharmacies that supplies your medication, we have control over the quality, of that, really allows us to do things extremely well, and allows us to do things that wouldn't really be possible if we were just sort of drawing from whatever compounding pharmacy we could find. It really improves safety. It improves efficacy, being that the stuff works better. So I think there's a lot of things that separate us from some of the other HRT companies.
Absolutely. And our next question tonight is from Randy. And Randy is wondering, she says, is it normal to get a period after 8 months with no period? She says, after I've started HRT.
So if you've only gone 8 months without a period, like for any reason, that means you haven't actually gone through and actually completed menopause yet. So unfortunately, the clock kind of starts ticking. It depends on how old you are and the bigger picture. But if you were having periods regularly and then you kind of stopped, but then you had another one 8 months in, that means your body is still kind of in this transition. So if you've gone 12 months or more and you're over the age of 50, that means you have completed menopause. So it would be unusual to get a full-blown period again after that, even with starting medication. So this just means your body is still kind of in the process, still in the transition. So it can be normal for you.
But I would add that even people that have completed menopause sometimes get some bleeding when we first start HRT.
Right.
And it's annoying, but it's not dangerous or scary. So that's important, for someone else that has gone more than 12 months. If you start HRT and you have some bleeding in the first month or two, don't panic. It's within the normal realm and not particularly dangerous. Now, if you've been on HRT for a long period of time and all of a sudden out of nowhere you have abnormal bleeding, that's something you want to let us know about.
And our next question tonight is from Cheryl. And Cheryl's wondering, she says, is vulvar atrophy reversible, specifically clitoral atrophy? She says, one day she was there, the next, poof, she disappeared. She says, I've been using my bioidentical estrogen cream as directed by my doctor for about 9 months, and I've not really seen a difference. She says, it's been pretty distressing and frustrating. Is there any advice you can give?
So generally, these kind of changes happen gradually over time. It's not something that would happen overnight. But once there is significant tissue change, meaning that, the labia minora retract in and sometimes the clitoris kind of retracts in, it can be hard to reverse that, So hormone therapy and using like topical estrogen in the vulva and vagina can help make those tissues more elastic, more supple, help restore health to the tissues. But if anatomy has been changed with those changes over time, it's not going to reverse those. So if you haven't already seen or, had somebody really do a good vulvar exam, and if you're seeing like a regular family practice doctor or an OBGYN, you can always ask to be referred to like a vulvar specialist, because there could be other things going on too. There's other disease processes that we, see and treat that sometimes can cause those loss of anatomical features of the vulva, and it can be more concerning. And that's something that wouldn't be treated with estrogen alone. So it might be worth getting a more in-depth exam of those areas if you haven't already.
Yeah, there's something, especially this happened fairly quickly, called lichen sclerosis, which is actually treated with a steroid cream. And it actually is treatable. But estrogen's not going to fix it. So if you're finding that the estrogen is not working, particularly if you've tried topical estrogen, you definitely should be seen for an exam, because it may be something that's actually fairly easily treatable with, but just with a different cream.
Right.
So that's important, because there's, you don't want to suffer needlessly if there's something that's easy to treat, but that's something that needs, a physical exam. So you really need somebody in person for that, and somebody that knows what they're doing.
Awesome. And our next question tonight is from V. V says, "Hi, everyone." She says, "I have a question regarding the safety of HRT and hypothyroidism." She says, "Is it all right to take HRT with a 25 milligram dose of levothyroxine?"
Very good, Maddie.
I know. I learned new
You
things.
think a doctor out of you, yeah.
But yes, it is safe to take thyroid medications with HRT. The important thing with that is that if you're someone who is getting your thyroid labs and your doctor who's, really managing your thyroid disorder is having to adjust dosage a lot, just make sure that you stay on top of that. Because if you're still trying to find that sweet spot in that medication that's really keeping your thyroid in check, you want to make sure that you stay on track with that. But yeah, they're safe to take together.
And our next question is from Christina. And Christina's wondering, she says, "Will HRT also help with migraines that seem to be triggered by my hormone cycles?"
It could be. So for some women, starting hormones can kind of trigger migraines, but also migraines can also be a presenting symptom of perimenopause and menopause too, because it's the fluctuation of the hormones and the erratic nature with which they're getting released in your body that can sometimes trigger the migraines. So for many women, the getting on a steady dose of HRT can help mitigate that and can help make the migraine frequency decrease significantly. So that's something that could help. But every woman is unique.
If the migraines are sort of menstrual migraines triggered by your menstrual cycle, I found this can be very helpful for that for a lot of women. So I think there is hope that it will help.
And our next question is from D. And Dee says, "I started taking my progesterone cream and the DHEA. She says, I've been feeling better, still having some hot flashes. I would regularly have a period and that they would only last for about 2 weeks and subside for a week or two. She says, I still have some brain fog and I've not now had a period since the second week of May. But she's wondering specifically, what does the DHEA help with specifically? She says, I've also noticed I'm a bit more tired."
So for the DHEA supplement, for a lot of women, it really helps with energy levels. It helps to combat fatigue. It can help with your muscle maintenance and your overall stamina, so your ability to exercise and have physical activity, but it can also help with your sex drive and libido as well, because it gently increases your testosterone level. So, and it can also help with bone health too, but mainly it's those other things. It's the energy level. So if you're feeling more tired than usual, you might benefit from an increase in the DHEA. So you can always reach out to your Winona doc to see if that's a possibility.
Absolutely. And our next question tonight is from Kat. And she is wondering, she says, "Will starting estrogen stop me getting periods?"
No. So starting HRT is not going to stop your period. Basically, these doses and the medication we're giving is not going to suppress what your body is doing naturally on its own. Basically, we're adding back in medications that your body, your hormones that your body is no longer producing in adequate amounts anymore. So if you're still having regular periods, you will continue to have regular periods until your body would normally go through the transition of stopping that.
Absolutely. And our next question is from Jeanette. And she's wondering, she says, "I've just started the cream and DHEA. I'm about 1.5 weeks in. And she's just wondering kind of like what to expect in the coming weeks. She says, I'm wondering if symptoms like hot flushes and insomnia will kind of regulate as time goes by. She says, I feel like the first few days were great. Now I can't quite fall asleep. So I'm just kind of wondering what to expect."
Yeah, so it might be, your body is adjusting. Sometimes patients need to experiment with the time of day that they use their medications too. So that sometimes might be something you might be, worth trying. A lot of women will start out using the cream and using the medications in the evening. But some women can get activated when taking hormones and they can actually get more energized. And so their sleep may not be as restful, or they can't stay asleep, or have a hard time falling asleep. So, reach out to your Winona doc and let them know. But it might be worthwhile to try using the medication in the morning to see if that makes a difference in your sleep at night. And I really encourage women to have a way to kind of sleep track if possible. So if you're somebody who likes to wear an Apple Watch or, whatever, I wear a Fitbit. That's how I track my sleep. Some people will use that new Aura ring. There's all kinds of things out there that we can use to help us manage our health. And I think it's really good to actually track how many hours you're sleeping and what kind of quality sleep are you actually getting, because it makes a big difference. Because then you can make little changes and see how it affects that and see if it gets better.
The other thing, if you're only a week and a half in, you're still in a transition phase. So a lot of women, unfortunately, find that things get a little worse before they get better. Rarely a lot worse, but because the body doesn't like changing hormones. So when you first start HRT, your hormone levels are increasing until you get to about the 3 to 4 week mark. And then you achieve what's called a steady state, where you now have the extra hormones that you're supposed to have, because they're not kind of still going up. So they kind of reach a nice steady state, and the body likes steady state. And so sometimes symptoms can get worse while you're getting to that point, and then things level off, and then you start seeing improvement. So it's actually fairly common to see that. I also see this a lot where people say, well, the first few days were fantastic, and then all of a sudden, like, it's not good anymore. What happened? And I think there's this sort of initial benefit from this like quick pulse of hormone, and then you start getting into that changing hormone issue. I don't have hard science for that, but that's kind of how I kind of logic it out. But it's really the long-term benefits. So hot flashes, sleep is usually early. A lot of times people see benefit for that in the first month or so. Some of the other things, like we were talking about the weight, that can take a lot longer. So you kind of get some benefits early on, and then the benefits kind of stack up. But it usually takes, I'd say, a good 3 to 4 weeks before you really start seeing significant benefit from most people. So if you hang in there, I think you're going to be happy with the outcome. But certainly, experimenting with the time of day, like Dr. Kat was saying, is certainly something that is worth trying as well. The patience will pay off.
Absolutely. And it looks like we have 2 questions next from Olivia. Her first part of the question is, what is the maximum dosage a woman can use of the HRT? And then her next question is, should we also be seeing positive changes in our hair health and restoring thickness if we're using HRT?
Well, so I would be reluctant to start talking about specific dosages, in a forum like this, because I really think it's individualized. I think that each patient, each woman has their own dose that they need. And for us in this field, there's not like a danger zone, like don't go above this level. It's something that it's a fine tuning. And this is where the art of medicine comes in. And it's not just about algorithms and plugging in, a square peg into a square hole kind of thing. And so I would be reluctant to talk about that. Now, if you're concerned, like if you're on HRT and you're worried about your dose being too high, have that conversation with your doctor and let them know. So, and what was the second part of the question?
Just wondering about hair health and restoring thickness with HRT.
Yeah. So generally, most women start to see a lot of benefits to their skin and hair and nails when they actually start HRT, because those tissues are restored. Their elasticity is better. The hair generally gets improved. The skin gets more supple, more hydrated when taking HRT compared to not. And so most women will see benefits with this.
Yeah, the hair, is another one of those ones that seems to take a long time, mostly because of the way the hair cycles. So hair can be on a 4 or even 6 month cycle. And so it can take a long time before that cycles through and you start seeing the benefit. The other thing about dose is even what we can think of like really high doses of HRT are still really small compared to birth control. So there isn't really a ceiling. But yeah, like Dr. Kat says, I mean, I've got people on what I would consider a teeny dose that are having like side effects, and have people on like really significant doses that we need to push it even more to get them benefits. So it's actually impressive how variable it is.
Absolutely. And we have a question kind of a little bit on the touch of, dosage. We have a question from D. And D is wondering, can you take an extra DHEA if you feel like you need a higher dose and you just got your second refill?
So I would reach out to your doctor and let them know that you're interested in doing that, just so they can kind of talk to you about it. But yeah, I mean, generally we start most women off on the 25 milligram dose of DHEA. And if they feel like they could still use some improvement with those things that DHEA can help treat, sometimes we do bump them up to 50, but I wouldn't do that on your own without having the conversation with your doctor. Just keep them in the loop. We've talked about this before, Mike, in that there's certain people in your life you should never lie to. And it's really your doctor, your accountant, and who else? Your lawyer.
Your lawyer, right?
Yeah.
This is the people you don't lie to.
And this is where I get to give my spiel, and I think I've given it on several different webinars. And Maddie, you're going to think I'm a broken record, but
I love it.
I don't think that most patients realize how very important it is for you to be completely open and honest and transparent about everything that you're taking. And this includes vitamins, minerals, your medications. And I actually barked at my husband about this. Went with him to a doctor's appointment about a week ago, and he was writing down his medications, and he's like, well, I don't take any medications. I'm like, okay, what about this? He goes, oh, well, that's for that. And I'm like, write it down. And then I was like, and what about your fish oil? And what about this? And what about that? He goes, well, those are vitamins. I'm like, write it down. It can interact with medications. And he's like, really? I'm like, yes, it can. Write it down. So please make sure that you are open and honest and really give a full account of what you're taking, what medical conditions you've been diagnosed with, because we want to make sure you're safe. And that's our first goal in caring for you, especially at Winona, but anywhere, is that we can't take the best care of you if we don't have all the information. So, that's something so very important to include.
Absolutely. And what, Dr. Brown, with you saying, that you're going to sound like a broken record, I feel like if you're going to sound like a broken record on something, that's probably a good thing to be sounding like a broken record all now. So that's a good one for sure. Our next question is from Heidi. And Heidi said, my friend suggested testosterone bio HRT pellets, but she says, but I see that that's not something you provide. Do you provide something that would be similar to this?
Let me take that one because I feel strongly about it. I am not a fan of the pellets. So the BioT pellets, here's the concept. So first of all, women need a small amount of testosterone. Absolutely, it's important for women. But estrogen is really the dominant female hormone. It's the one that gives the vast majority of benefits. Men, on the other hand, need more testosterone. That's the primary hormone for men. The concept of BioT is that if we give you enough testosterone, your body's going to say, whoa, that's too much testosterone, and it's going to break it down into estrogen. It seems like a backwards way of giving somebody estrogen. And it really tends to cause long-term side effects. So what happens with the BioT is you get this implant that's got the testosterone in it. And that is now a good 4-month commitment because there's no takesies backsies on that. They implant it under your skin and it dissolves until it's gone. And so if you don't like it or it doesn't work or it's too much or it's causing terrible side effects, you basically have to deal with it for 4 months until it goes away. So, there's a commitment issue on that part. But the other thing with testosterone, when you give a big slug of testosterone, it can give people this sort of testosterone euphoria. And so you feel really good. And then what happens is it wears off and then you want it again. And eventually it starts building up and starts causing testosterone side effects. So typically what you see with this is people are super happy for the first pellet or two, or maybe even 3. And then all of a sudden really bad things start happening. I see a lot of this and it's really kind of sad. So it can cause a lot of bad side effects. It tends to be, in my opinion, it's sort of the backwards approach. So in my opinion, much better off getting the primary hormone primarily. So that's estrogen. And then supplement with a small amount of testosterone, which is what your body really needs. So we do not have testosterone on Winona. We're not able to do it because it's a controlled substance in most states. So we can't really provide it through telehealth. But the DHEA gets broken down within minutes by your body into testosterone. And the nice thing about DHEA is it's a much gentler way of doing it. So at the doses we use of 25 to 50 milligrams, you're not going to overdose people on testosterone. You're not going to get those scary testosterone side effects. It's going to be just enough to get your testosterone into like a normal female range. Now, look, if you want to be a competitive bodybuilder and you want to juice up, that's a whole different story. But I don't think that's really what you're after. Hey, no judgment. If that's what you're into, that's great. Knock yourself out. And if so, then you really want to pursue, significant testosterone therapy. But if you're really looking for the testosterone benefits of HRT, you really want a small subtle dose, because that's going to get you there without causing these, what we call andronizing, the male type side effects that can be disturbing for people.
Absolutely. Well, and
That's my soapbox on the BioTE. Sorry.
Yeah, no, I think that it's important to talk about,
Absolutely. Well, and that looks like that was all of the questions that we have kind of in the chat for tonight. So I was going to say thank you, Dr. Green and Dr. Kat, for your time. I know that these like live Q&As are always so great just to kind of get to hear, your all's perspectives and kind of to help, women that, really have these questions. And so I just want to let everyone know as well who's here. We see this every time, but if you are a Winona patient, your Winona doctor is available 24/7 in your patient portal. Also, if you want to become a Winona patient, that's also a really great perk as well. It's like having one of these Q&As just in your pocket all the time. The doctors are there to answer any and all questions you have. So please reach out to them. They really, really do want to hear from you. We also have a podcast. It's called the Menopause Hour. It should be wherever you get your podcasts, but Spotify, Apple Podcasts. So, if you're driving to work, you're driving home, and you kind of want to listen in, you can kind of look that up as well. But that's a great place to kind of get some more information. So please check that out as well. But thank you all so much for being here tonight. Thank you, Dr. Green. Thank you, Dr. Kat. We really appreciate your time. Awesome.
Everyone. Out. And if you're a Winona patient, download the app. Get on the app. Maddie?
Please. I would love to see you on the app. I'm in there all the time. So if you get that, you'll probably see me commenting and liking posts. And we have events. We have courses. We would love you to kind of come join in our conversations there. So hopefully I'll see you all in the app for sure. Awesome. All right. Good night, y'all.
Night. Have a good one.
Thank you for joining the Menopause Hour, brought to you by Winona. Menopause care made easy. To learn more, find Winona at bywinona.com and on Instagram at bywinona. Want to have your questions answered next? Register for our upcoming live Q&A, linked in the show notes.